to, da te rakave celice izgorevajo tok sladkorja. Ali to potem res, da ne bi se rakavi bolniki oziroma ne bi se izogibali sladkorju, da ne bi uživali sladkorja?
Because the tumors are supposed to be eating the sugar.
Yes.
Is it true that the cancer patients are supposed to be avoiding eating sugar and sweets?
Well, we have to make a definition of the word sugar first. Okay? The tumor is not taking sugar, it's taking glucose.
Ja, tumor v bistvu se preživlja
single
črpa glukozo, ne?
Yeah, so, yes. And you should avoid sugar in a big amount, okay?
Treba se izogibati sladkorja v velike količine.
But some people, like in Germany, there's a book out which is saying, just stay away from all the glucoses and the tumor will go.
Ja, obstaja v Nemčiji neka knjiga, ki pravi, da enostavno se izogibate glukozi in tumor bo izginil.
But this is not working.
Vendar to ne deluje.
Because if you don't eat carbohydrates, which then produce the glucose, your liver will do it.
Ja, ker če ne jeste oglikovih hidratov, iz katerih potem eventualno nastane glukoza, potem to naredijo jedra, ne?
Think about your brain can only take sugar.
Ja, pač možgani funkcionirajo na glukozi, ne, na sladkorju.
So if you don't eat any kind of sugar, your liver will produce so-called ketone bodies.
Ja, če ne zauživate sladkorja oziroma oglikovih hidratih, potem to pač jedra proizvedejo te ketone, ne?
Ketone,
ja, ki pač nekako hranijo telo.
Yeah. So what you have to do is, you know, let me say a person with 60 or 70 kilograms of body weight.
Ja, oseba, ki tehta recimo 60-70 kg,
needs about 60 to 90 grams of carbohydrates.
potrebuje 60 do 90 gramov oglikovih hidratov.
So you should not eat less, but you also should not eat more.
Ne bi smeli jesti manj in niti ne bi smeli jesti več.
So you can eat some carbohydrates, so-called long-chain carbohydrates.
Ja,
So like rice or potatoes.
lahko jeste oglikove hidrate s temi dolgimi verigami, ne?
Don't go for the pasta.
Ne makaronov, ampak recimo riž, pa krompir sta v redu.
But rice and potatoes, it's okay.
Riž, krompir, makaroni ne, oziroma testenine.
What about honey?
Honey? Honey is also okay, even this is very fast sugar, but the amount is important. So if you have 1 teaspoon of the honey, it's okay. If you have 5, it's not okay.
Ena čajna žlička medu je dovolj, 5 jih je seveda preveč.
But honey, don't make the mistake and say honey is sugar. Honey is medicine. This is why in the Budwig diet you also eat a little bit honey.
Ja,
So honey is quite more than just sugar.
med je več kot samo sladkor, med je v bistvu zdravilo, zato v dieti dr. Budwigove tudi je vključen med.
Yeah, the man over there. Ja, gerne, ja, selbstverständlich. But you, she will translate it then, yeah. But then when she don't understand, dann versteht sie nicht, sorry.
Ja.
Ich habe den Buch vor Jahren gelesen.
Ja.
Und hat mir sehr gefallen.
Danke.
Und ich habe die Ehre, Sie kennenzulernen persönlich. Was sagen Sie zu den Säurebasengleichgewicht im Körper, das heutzutage also bei dieser Ernährung, bei der heutigen modernen Ernährung eine Übersäuerung herrscht?
Ja, ja.
Und die Säuren wissen wir, dass die Grundlage sind für eine anaerobe Stoffwechsel.
Ja, definitiv, ja.
Und ich glaube, also die Leute wissen zu wenig darüber.
Ja.
Wie wichtig das ist, und dafür natürlich uns auch in den Bereich der Ernährung. Ne?
Ja.
Eine wichtige Ernährung, also die auf der paläolithischen Ernährung basiert.
Yeah. He's, maybe you translated, I understand better. He's asking about more about the acid-base balance in the body, but I can say a little bit more about this. Maybe you say it in Slovenian for the people.
Ja, gospod je spraševal o tej kislinsko-bazičnem ravnovesju v telesu. Če sem se prav razumela tudi nekaj o tem od paleolitske diete.
So, first of all, there is a big misunderstanding in many books when it comes to acid-base balance.
Veliko nerazumevanja oziroma napačnega razumevanja je v velikih knjigah napisanih na temo kislinsko-bazičnega ravnovesja.
Because in most of the books, maybe not from Dr. Sander, but from the others, they all writing that we humans are too acid.
V večini knjig piše, da smo pač ljudje preveč zakisleni.
But this is only partly true.
Vendar je to samo delno res.
Because cancer patients, they are in the normal tissue too acid, but they are too alkaline in the blood.
Ker večina rakavih pacientov je sicer v tkivu, tkivo ima zakisleno, medtem ko ima kri pa preveč bazično.
I have seen quite often patients, they bought a book about acid balance, and in the books they always saying, oh, you are too acid, so eat a totally alkaline diet.
Ja, zato potem pač ljudje kupijo knjige, v katerih piše, da so preveč zakisleni in da morajo jesti popolnoma bazičen diet.
And then they do this for maybe 2, 3 or 4 weeks, and then they take the book and they throw it away.
In potem to delajo in par tednov in eventualno pač knjigo vržijo stran.
Because they feel worse than before.
Ker se slabše počutijo, kot so se počutili prej.
So you have to understand in the Budwig diet, but not only with Budwig, there is other doctors like Koch, like Kohl, like Issels. All these other doctors, they said all the same, and I also say the same. What you have to do is, you have to bring the acid of the tissue out, but you have to bring down the pH value of the blood.
Ja, problem je tukaj, je rekel, ker se strinjajo in dr. Budwigova in še nekateri drugi zdravniki, da je treba v bistvu zvišati pH tkiv in znižati pH krvi.
So, and how do you do this?
Razkisliti tkiva in kri pa v bistvu nekako dvigati več proti kislini, da niso, ker je preveč bazična.
Do you know how you make it? What is the first thing in the morning you do? You drink a glass of sauerkraut juice.
Zjutraj nateščen, oziroma prva stvar, ki jo popijete, je kozarec soka kislega.
What is in sauerkraut? Lactate. A so-called right-moving lactate.
V tem soku kislega zelja so te mlečno-kislinske bakterije.
And sauerkraut, or it's not only sauerkraut, any kind of fermented juice.
Oziroma tudi vsake druge vrste, ta fermentiran sok, fermentirana pijača.
Is doing 3 very good things in your body.
Naredijo 3 zelo dobre stvari v telesu povzročajo.
The first thing is it brings the pH value down in the blood.
Prva stvar je, da se pH krvi zniža.
The second thing is a part of this lactate goes into the tissue.
Del te mlečno-kislinskih bakterij gre v tkiva.
And you know, a tumor is producing also a lot of lactate, but a so-called left-moving lactate.
In tumor tudi proizvaja te mlečno-kislinske bakterije, ampak levo orientirane, medtem ko iz tega soka kislega zelja oziroma fermentiranih pijač pride nekako desno sučne, če sem jaz to prav razumela.
And now the right-moving and the left-moving lactate, they goes together.
In te levo sučne in desno sučne se potem združijo.
The chemist people call this racemate, is the chemist word for that.
Ja, no.
So,
Ne vem, kako kemiki to rečejo.
yeah. So, and now this, which stays very hard together, goes back to the blood.
In to, te pač, ki se združijo, grejo nazaj v kri.
So a part of the lactate, which normally stays in the tissue, goes out of the body through the kidneys.
In na ta način se pač prek ledvic tudi izločijo te mlečne
This is the second good thing. And the third good thing is, through that, you have more energy in the body.
Ja, in tretja dobra stvar je, da pač imate več energije v telesu.
Yeah. Do you remember from school the chemical, what is lactate and what is sugar? Maybe you forgot it. I'm sure you learned this here. It's C3H6O3 is lactate. And exactly double C6H12O6 is sugar. So this is an unbelievable genius system from the evolution. That because lactate, you know, when we're moving, our muscles are producing lactate. But also the tumor is producing lactate. So it's a very nice system that the lactate goes into the blood, from there to the liver, and is creating sugar, and sugar is the best energy you can have in your body.
Skratka, te mlečne kisline ne bi šle v jetra, iz katerih potem ta jetra izdelujejo sladkor, in to je najboljša.
So to answer your question, what do you have to do is very easily. Take a diet where, let me say, 80 to 90% is alkaline diet.
Najboljša dieta 80-90% bazična.
But 10% must be a fermented thing which brings down the pH value of the blood, and this must be lactate you are drinking or eating. It doesn't matter, you can eat sauerkraut.
Najmanj 10% pa ne bi bilo pač neke kisline, ki zniža pH krvi.
Okay. Okay.
Hvala lepa za vprašanja, hvala lepa za obisk. Thank you for coming.
Thank you. Thank you for being here.
Če mi se že z njim moram povedati, jaz sem še.
No, very nice. Thank you very much.